Good day. This is Dr. Baristani, and today I have the pleasure of bringing a very interesting participant to come and talk to us about her experience with what functional medicine is, and really why this is so interesting is because this is Senator McConaughey. So Senator McConaughey actually is a big fan of functional medicine because it's really helped her. And so this is why I just think it's fascinating when you hear from someone who is very respected, who understands a lot of the ways the world works. It's great to see someone sharing their experience. So really, kind of my hats off to you. And so take it from here. Give us a little bit of your background and what brought you to me.
Well, thank you, Doctor. It's a pleasure to be here. Yeah, so my story starts probably, I would say, around 2020 at the beginning of COVID. Prior to that, I was 63 at that time. And prior to that, I had the typical issues that 63-year-olds deal with, mostly high blood pressure. But other than that, I was a relatively healthy person. I had acid reflux and some gut issues going on. And I was at that time frustrated with conventional medicine. I just was not getting the kind of results to deal with gut issues that I was looking for. Then 2020 happens, COVID happens, and I had retired from the Senate by that point, and I was doing consulting around the country and traveling a lot. So I caught COVID very early in the game. My first diagnosis was in March of 2020, so it had just come to the States in January. So it was very early on. Over a 2-year period, I was probably diagnosed or tested positive for COVID at least 4 more times. It was suggested by my daughter, who is one of your patients as well. Uh, I was very frustrated because I had developed long COVID. I didn't know it. Nobody was talking about long COVID at that point. I had done some reading and saw that there were some doctors outside of conventional medicine who were actually addressing COVID with the understanding that the COVID can live in your body and really have an adverse effect on your health. So the combination between having long COVID and gut issues brought me to you because I knew that I had to step away from conventional medicine if I was going to deal with this. And so I would say we started a partnership because the things that we did, that you had me do, required commitment on my part, which I was happy to do. And we've been working together since late 2022, so about 3 years now. And we have addressed together, and I really, really strongly think it's a team. It's teamwork because a
100%.
patient. Yeah, a patient has to be on board and has to do what you recommend for them to do in order for it all to work. So over that period of time, we have dealt with my gut issues, we have dealt with long COVID, and we started working on detox, which is probably the most fascinating part of the whole journey. I guess the two things that I think really stand out for me is I never thought that I would conquer long COVID. And that's one. And two, I never even knew how toxic my body was until you started testing it. Then we started the protocols for the detox, and we're not done with that journey yet, as you tell me. Um, but the last blood work or test results that you got back showed that I have essentially removed about half the toxins out of my body. And it shows by the way I feel. My health overall, when I look at where I was in late 2022, when I first met you and we started working together, to where I am today is night and day. I felt like I'm 68 years old right now. I felt 10 years older than what I am now at that time. Today, I feel like I have boundless energy. I feel good. I feel that I can do anything. So anyway, that's the short version of sort of what's happened over the last 5 years.
So first of all, Senator, it's amazing. First of all, most people once they get to 50 years old or 55 or 60, at one point they just start waving the flag and go, "All right, I've given up on my hopes and dreams of having energy and quality of life," and that's just not fair because a lot of times these are not actual natural aging things. Now sometimes they are, obviously, if you're 85, yeah,
Yeah.
you're going to be a little bit more fatigued. You're going to want to take naps. That's pretty normal. But nowadays, with the technology we have, with the advances in medicine, you should not be tired in your 60s. I mean, you're not going to be as energized as you were in your 20s, obviously. You're going to be doing an
Right.
Olympic sport, but you should be able to enjoy your retirement. You have a lot of time off. You should be able to sleeping well and restored, feeling restored in the morning, so that you can go on your European vacation, enjoy yourself, And I remember you telling me years ago I just want to be able to have energy on my vacation, or I want to be able to walk
Right.
on these vacations that I take. And you just said something like you went to, where was it,
Well, we
Italy?
just came back. We were in Europe for 4 weeks, almost a month. And at one time, I would never even have been able to do that. Back in 2022, I would not have been able to take that trip.
Right.
The result was we did it. I posted about 15,000 steps every single day. I never had a down day. Before, I would not have gone 3 weeks without having days where I just didn't feel like I could get out there and engage in a lot of activity. So it was it was sort of a testament to how far my health has come in the last 3 years.
So if you take a vacation, I just did the math real quick, that's 420,000 steps. So
Wow, I walked a lot. It was
that's
great.
insane. So
All through
yeah,
Europe.
so I'd say most 15-year-olds or 20-year-olds are not doing that much for that extended period of time. So first of all, that's amazing. But yeah, let's talk about a couple things. Let's unpack those comments you said. So first of all, you had gut issues, and that was I think probably one of the easiest things I think we addressed was most people have gut issues nowadays. They don't realize it, but it's the food we eat is very immunogenic, and so it primes the immune system. And since most of your immune system, about 70%, is in your intestines, it makes sense that if you're, let's say, allergic to almonds and you're eating or drinking almond milk every day, you're trying to be healthy, and now you're causing yourself to be, basically giving yourself IBS. A lot of these symptoms come from just food allergies. So recognizing, getting a good food allergy test, one that's actually peer reviewed. Most allergy tests are not. Make sure you have good allergy test. We like the Meridian Valley, for example. But the point is, get a good allergy test. Make sure you know exactly what you're allergic to. And then it's not like these are life-threatening IgE allergies. They're IgG and IgA, which just means they're not going to kill you with an anaphylactic shock, but they will disturb your peace in your intestines, and they can cause acid reflux, bloating, SIBO, diarrhea, constipation. So her gut issues were pretty quickly addressed, and that's also going to make you feel better. But when I first heard her story, I said, "Man, this sounds like long COVID." And back in 2022, which when we just started doing this, we didn't really know. We thought long COVID was this like long inflammatory sequela of the infection. Like you got the infection and you were just inflamed. And that's what everyone thought, except for in 2024 and in 2023. Harvard and UCLA posted, they made these two different independent papers, publications that were really fascinating because UCLA's paper was the most fascinating because the study went 2.5 years out. And it showed that most people that were symptomatic or had long COVID symptoms, generally being fatigue, brain fog, those are the two most common, then insomnia, joint pains, and other symptoms.
Yeah.
Most of those people had positive COVID viral active protein or RNA in their bloodstream out 2.5 years. And it only went 2.5 years because the study ended at 2.5. So it could have been longer than that. So long COVID means the virus is not leaving your body, it's persisting. And and then Harvard did another study that showed it went up to 14 months again because the study stopped at 14. And in both studies, they even found that that were asymptomatic, had no symptoms, thought they were fine. And oh, I got COVID 2 years ago, I'm fine. 40% of those people still had the virus in their body. So it's kind of disturbing because this virus is able to hide in your system. And now people are asking questions like, is this why we have more cancer now? Is this why we have more autoimmune? Autoimmune disease has been almost definitely correlated with this. The question is cancer also correlated? Because once you dysregulate the immune system, you can cause autoimmune disease, you can get cancer, you can get all sorts of weird stuff. So what we don't know is, in 10 years from now, like really how much damage did we get from this virus? But the point is, that there are a few doctors like that are Peter McCullough, who's a cardiologist who's very forward and bold, and he's published over 1,000 medical publications, really well respected, who's saying, hey, you got to attack the virus. You got to use things like ivermectin. You got to use things like curcumin or turmeric. You got to use things like bromelain, nattokinase. All these things that have some type of study or literature to show that it actually kills the virus. And so we have been kind of toying with them because we really didn't have anything else to help people. And we also use low dose naltrexone. I think the FLCCC is an amazing site with all sorts of long COVID protocols. It's a frontline COVID critical care alliance created by Pierre Corey and some other doctors that used to work at Mount Sinai Hospital in New York City, and had some incredible results using some protocols, international protocols. So I think there's a lot of forward-thinking doctors that are saying, "Hey, what else can we do for these patients?" I think the number one thing everyone should do is go to LabCorp and just go to LabCorp on demand. You can pay $69 and pay for your spike antibody test, and just see how high your spike IgG antibody is. According to Peter McCullough, who's looked at thousands of papers and tens of thousands of patients, and also based on my hundreds and hundreds of patients, and I've been tracking their spike antibodies. I do think there is a strong correlation where if you have a COVID antibody less than 1,000, you're generally okay. And if it's greater than that, we have problems. And the higher it is, the worst it is. For example, I had a woman who was 38 and she had a spike antibody of 24,000, which is one of the highest in my practice. And she had this new onset autoimmune disease, rheumatoid arthritis, but like one of the worst cases I've ever seen hit her just immediately, like, quote, out of the blue, which was probably from COVID. So I think we do have to pay attention. We think long COVID is kind of being ignored. The HHS actually showed that it's like the most expensive disease category of all of them. We are spending around $700 billion a year on long COVID, not acute COVID. And like cancer, we spend 200 billion. So in obesity, I think we spend 300 billion. So if we're spending 700 billion a year on something so powerful, then why are we not addressing it with more, you know, innovative protocols? What are we doing? We're just like, we can't just sit around and allow the tincture of time to pass because the virus is not leaving. So we have to kind of force it out. And from my experience, when you put people on these proprietary protocols, their COVID antibodies drop aggressively. Um, and sometimes it takes people 6 months, sometimes it takes them a year and a half, but they all kind of, and so that's kind of what happened with our senator here. She was saying, "Hey, I don't feel that great." I said, "Okay, let's fix your gut." Okay, she felt a little better, but she was still pretty tired.
Yeah.
We then addressed the COVID. She got significantly better in about a what, year and a half? It took a while.
Yeah, I would say. Yep.
Yeah.
Yep.
And just to highlight the partnership part, this functional medicine will not work for people that are not willing to comply or motivated to do what's right for their health.
Right.
Because I think at one point I had her. Oh, I'm gonna call you Senator Karen because it's easier. But I think I had you, Karen. I think I had you on 20 plus pills a day at one point,
Oh God,
probably.
yes. Yeah. Oh yeah.
And
And then you also we did hyperbaric.
yes, and we did 20 hyperbaric treatments, which was critical. And these
Yeah.
are real hyperbarics, not soft hyperbaric.
Correct.
Hard to
Yeah.
show, like 2.0 atmosphere, because there's a lot of data out of London and there's a lot of data out of Israel. Not a lot,
Yeah.
but enough.
Outs- Outside of the USA.
Yeah, exactly. Why are we studying this, right? But yeah,
Right.
in Israel, I think they took like around 50 something patients and put them in a hyperbaric chamber that had long COVID, and the results were amazing. In London, they only took 10 patients, but again, the results were incredible. And it's a safe therapy as long as you know how to do it and you're trained. But I've had so many patients who love the hyperbaric. But the point is, we got Karen over these two large humps, and then the third one was, well, what else is causing fatigue? And so then I said, well, Karen, we have this amazing new lab that can see basically every toxin that's coming out of your body. Because
And
toxin,
I was skeptical when you first suggested that to me. But I said,
I
okay,
like
fine. If you
skeptics.
think I need to do this test, I'll do this test. And I
Yeah.
thought, oh, there's nothing to. I really didn't. I was skeptical.
Yeah,
No
well,
question.
I think it's good. I think skepticism is because you've developed really strong critical thinking skills as a senator. You know there's a lot of BS out there. I think it's great. I think you have to be in anything you did. I was skeptical when I took probably, I don't know, 18 courses in IFM, functional medicine, A4M. I'm certified through the Cleveland Clinic. Like, I took so many courses, and probably until my fifth one, I was still skeptical. I was like, wait a second, this can't be right. This can't be right. We're full of toxins and we're not addressing this in traditional medicine. Why not? And then I said, well, let's put it to the test. And then once you start getting these cures, at least for me, it was like an addiction. I'm like, this is amazing. I can make people feel so much better. And this is all I want to do now. But initially,
Well, and can I add one thing to that? Is that because I think from a layman's point of view, we all hear that we've got toxins in our body, but unless you actually do legitimate testing, you don't know what that really means, right? And there's all kinds of detox programs out there. You can buy a set of juices to take for a week that'll detox you, but you never have any way of knowing unless you do the testing as to whether where you started and where you're going with a detox unless you do all of that. That's just
Okay.
from a layman's perspective.
Yeah.
We're all in the dark. I had no idea how toxic my body really was, and you're feel free to talk about how toxic I was.
Well, if you want, I can share your before and after.
You can,
Okay.
yeah, you can.
I'll do that real quick. But so let's just talk about that for a second. When you take the functional medicine training courses, you're basically taught by these extremely talented. I mean, these people are from Ivy League institutions, Harvard, Stanford, and they're saying, hey, we're living in a hodgepodge of toxins. The problem is there's no FDA approved test, believe it or not, to check to see if these toxins are messing with you. Um, so anyway, so the testing that we tested on you showed without a shadow of a doubt your toxin levels and the different types of toxins. To your point, there are so many like I call it like not they're not it's not BS, but it's kind of like it's they're kind of confusing the consumers when they say, hey, this is a detox kit. You take it for 3 days and it cleans you out. Well, that can mean a million things. If I give you enough laxative, herbal laxative, you can clean your stool out, which is a form of detoxing because stool has waste.
Right.
Some of that stuff, for example, some green smoothies, okay, something that has certain, like celery juice, for example. Celery juice can potentially pull some metals out of the local intestinal tract. But that's not going to chelate the heavy metals out of your body. It's not going to go into your bloodstream, grab the metals from your organs, and that's like a chelator. That's a real heavy metal chelation. It's also not going to take the mold in your sinuses, your gut, and take the mold out of your body. It's also not going to go into your fat reserves and take that actual fat-soluble pesticides, herbicides, carcinogens. Because remember, most of this stuff is fat soluble. Every toxin, by definition, is fat soluble. Otherwise, you would just pee it out, poop it out. And the liver has to work overtime to make the fat soluble substance into a water substance so that you can urinate it out or poop it out. The only other way you can get this fat soluble toxins out of your body is by sweating, which is why sweating is so important. Like if anyone like can buy a sauna or just use a sauna in the gym and just
Which
sweat 2 or 3 times a
which you
week.
did you did convince me to buy one. So I now have an infrared sauna at home and use it at least 3 times a week, and my husband uses it as well, and it has reduced the inflammation in my body immensely.
Yeah.
And I can tell because I'm just not as achy that I've got the arthritis under control, so on and so forth. It's just, and that was something you recommended.
And people don't realize this. Like every time you go on a golf course, you're gonna get some pesticides. Every time you eat non-organic food, you're gonna get some pesticides. You're constantly gonna get some stuff, and you can't live in a bubble. Like I'm not telling people not to have fun. Like live your life. But if you can detox faster than you accumulate, you've won the game. That's just a game, really. So I want to share this screen because I think people are gonna really appreciate this.
Pretty
But
amazing.
this is her before and after at 6 months. And on the left, you can kind of see that she had a lot of BPA, which is plastic. This comes from plastic water bottles, plastic cutting boards. Also, for example, prior to 2008, Starbucks used to put BPA in all of their cups, their paper cups at the thermal liner. And now, thank God, most of these companies don't do that. But remember, these are like kind of like forever chemicals. So they can stay in your body for a very, very long time, like 2, 20, 30, 40, 50 years. So unless you pull them out, they're not leaving anywhere. And you can see our initial BPA level is 19. You can see after 6 months it's down to 6.44. That's a massive drop, more than 50%. And that is not going to happen unless I push this out aggressively. My patients that don't comply with all the things that we tell them to do, this doesn't move. This is a great part of it. This is how you know this test is accurate. You can do the husband and the husband, the wife and the wife, and they're exactly the same. But when you help the liver using a lot of proprietary protocols that we have, you can really dump these at an aggressive rate. And for example, these parabens that she had, this paraben and this paraben, very common in moisturizing cream. I think we recognize that one of the moisturizing creams that Senator Karen was using was actually full of parabens. And
Right.
make sure your moisturizer cream is paraben free. And then these are pesticide derivatives here. She had a little barium, which could have actually come from Himalayan salt. We see that Himalayan salt
I
actually.
used to use a lot of Himalayan salt.
Yeah. Yep, exactly. Or it could have come from a barium swallow CT scan or a barium swallow X-ray scan. And then you have these mold toxins that come out like you look like radiation mold. She had multiple mold here. You can see one, two, three, four, five, six, seven. Here she only has two. So more than 70% reduction in her mold toxins. And because I put her on an antifungal actual medication, not just, some chlorella and this and that and cucumber. No, you have to really address these, otherwise they're not going to move. And then you can see her atrazine also came down. The this is the dark blue is the current levels, light blue is the previous levels. You can see a nice drop in all these chemicals, all the way down the board, really. So, this is just 6 months in. We're going to repeat this soon. We
Right.
see a drastic improvement. I've done this so many times on hundreds of patients. It's consistent and it's really nice. And the most beautiful part about this was not just was there a, objective reduction in chemical toxins. That 6 months was when, Senator Karen comes up to me and says, "Hey, I just took a vacation and I walked 15,000 steps. I haven't done that in years. This is
Yeah.
incredible. My energy is way better. I feel so much better." And it was a clinical benefit that makes me say, "Hey, I like my job. I want to keep doing this."
There's
So
no question that this 6 months was the game changer, I think, health wise for me. Not that, I mean, that was quite a hill to climb with the COVID stuff, but this was different. This just took me to feeling good in a way I hadn't felt in a really long time. So I'm a true believer in true toxin detox, but doing it the right way, obviously. Because I tried those things. I tried, all the different off the shelf detox, but who knows what I was actually getting rid of? There was no way to measure it. This you convinced me because we measured it, and that's the difference. When you can take an independent test, here's where you started. This is the amount of toxin that was in your body, which was obviously, as you saw, significant. And now it's half of what it used to be. And now we're working to reduce it half again. That's when you realize you're making a big difference in the quality of your life, your health.
yeah, and just obviously I've done like five of these tests myself, and I've gotten myself just down to two in the orange. So like it's great. It's like you're
Awesome.
competing against yourself to get yourself clean. And even my wife, we're planning to have a baby soon. I was like, first get that out of your system, and we're serious. We're getting this out of our system first. We did a whole podcast on that because we know these things can be transferred placentally. And so think about how many young women are walking around, they
Yeah.
think they're fine. And a lot of it's genetic. We do genetics on people. Like certain genetics don't detox as well. So, it just depends. If you don't detox well, plus you're given anywhere in the world, you're going to be exposed. Certain people will, for example, accumulate arsenic worse. Some people will accumulate BPA worse. I actually had this older gentleman who we thought he had Parkinson's. It turns out to be arsenic poisoning. And the Department of
Wow.
Health of our county got involved and said, "Hey, is this person being poisoned?" And we didn't know. What the case was, it wasn't. It was just we think the person's um actual believe it or not, their cook was importing arsenic laden rice from China, not knowing, and it was full of arsenic too because he really liked jasmine rice. He was getting, I think, from India or from Asia, and it was full of arsenic. Shockingly enough, we figured this out. But yeah,
Wow.
and of course, if it's about 1 in 5 people that don't excrete arsenic very well. So he happened to be that 20%. Plus, he had that exposure. Boom, and then he had, I mean, such a high arsenic level. Again, the Department of Health was concerned, and once we got the arsenic out of his body in probably 3 months, his quote Parkinson's was about 70% better. And we were just like, "Are you kidding me?" And then we found papers showing that yeah, arsenic kills the actual cells in the substantia nigra that cause Parkinson's. So it's like, well, there you go. So a lot of stuff that we see, it's a combination of genetics and exposure. And you just have to know what's your exposome. And that's what the new word is. Like, what are you being exposed to? And how can you avoid being exposed to the wrong things? Well, that's kind of almost impossible. I mean, you can do your thing, like, instead of plastic, we do glass or metal bottles. Even this, right? I'm drinking out of a glass. This is a glass. Everything I do is glass. cutting boards, stainless steel. But God forbid you were born before 2008 and had some Starbucks in your life, you probably have some BPA in your system.
Right.
So everyone needs a detox. The question is, how do you do it? But again, I think it's great that people hear from you, a senator, saying, "Hey, this is real. I've experienced this myself," and not to mention my energy levels. It's massive.
Huge.
Would you say you're 50% more energy than when you first met me? 60%?
Oh, I'd say more than that. I'd say
Wow.
75. I mean, it's uh, uh,
That's
yeah, I feel healthier than I did before I got COVID. So that's the key,
yeah.
and that was 5 years
So
ago. And
so a lot of people say, "Hey, how do you do anti-aging?" Well, that's anti-aging. Reverse all the things that made you age, the toxins, the pollutants, the hormones, everything else that was bad. Fix your gut, fix your sleep, and boom, you feel better than you did in your 30s, right?
you feel younger. You feel
Yeah.
young. I do feel younger.
This is great. Thank
So,
you so much, Senator McConaughey.
yeah.
I really appreciate you being on with us and telling your story. I think people need to know about how to live better, how to optimize, and beyond just going to your doctor and saying, "Hey, you have high blood pressure. Listen, I'm an MD. I can help you with your blood pressure too." But what's the next step? How do you get to that next
Right.
level of health and well-being, right? That's huge.
Well, I appreciate the opportunity to talk about it because, I think there's probably a lot of people like me out there and who are skeptical. And I'm a skeptical person by nature. And, I like evidence, that something works. And so I definitely am a true believer in functional medicine. Doesn't mean that conventional medicine doesn't you have to have that. I mean, it
Mhm.
has its place, but there's just some things that conventional medicine is just currently not designed to address effectively. And so that really creates what I believe is a need for functional medicine. For anybody who really wants to maximize their personal individual approach to medicine, functional medicine is a key component to that.
Couldn't have said it better. You're amazing. Hope you have a wonderful rest of your holiday season. Thank you for
I
helping.
will. You too, doctor. Have a good
Thank you.
one.
You too. Bye.
Good night. Bye bye.